Morning, Volusia County. The other day on Facebook, I asked you to send me questions to ask the experts, and you definitely didn't disappoint us. We got over 750 questions and comments. A lot of them hit on the same issues: testing, closing the beach, stay-at-home order. A lot has happened in the past couple days to answer those questions, and I really appreciate you taking the time to participate. This panel here has a lot of valuable time, and their time is valuable, I should say, and they're here today to try to get as much information as we can out to our community so that you can make informed decisions about you and your family's health. I think it's important to remember, as you hear these experts talk about different things that are going on in Volusia County, we cannot let panic and fear cancel out common sense. So I'm proud to introduce our panel today. A good friend of ours, Dr. Margaret Crossman, the Chief Medical Officer for Halifax Health. For the Volusia County Sheriff's Office family, Dr. Crossman was one of the first people on scene when she was off duty, her and her husband, to help out Frank Schofield during his tragic bike accident. On behalf of the Volusia County Sheriff's Office, thank you so much for what you did for Frank and his family that day.
Thank you.
Also, Dr. Joe Smith, Chief Medical Officer at Advent Health. Holly Smith, Communications Manager with the Florida Department of Health. Our County Manager, probably the hardest working person in this room, George Reckenwald. And Dave Otati, the Regional CEO from Advent Health. So thank you for being here. So we're not going to waste any time. We're going to get right into it as this unprecedented crisis unfolds. What has it made the hospitals and healthcare and medical folks readjust their paradigm and say we need to be going in a different direction? What are some of the things that you're seeing?
Telehealth. So telehealth is something that I think everybody has to some extent, but this has greatly expanded our telehealth options. We started with our outpatient practices and really expanded it into them. We knew that it was very important for patients to be able to see and access their physicians and also to get guidance, decompress all the calls into the health department and into the emergency departments. And so getting our primary care offices back up and running in that capacity has been wonderful. Also internally, looking into some of the different telehealth expansions of what we currently have, so that if we have those contingency plans, right, and you have a handful of intensivists trying to help give guidance into the care and of the vent management specifically for multiple patients, it's going to be helpful to have it where they can access in more remotely and give that guidance. So telehealth has been one of the big things for Halifax.
I think for Advent Health, telehealth, also a big learning. I think we were already, as a company, on a journey to think about how we can bring healthcare to people outside of a hospital, right? How do we provide community access points outside of an emergency room or a hospital for patients? And if anything, this pandemic has really validated for me the strategic vision of Advent Health, and I think that we will probably see that accelerate even more. We will, I think, years hence, right, we will look back on this and say, wow, we really kind of used a hospital for everything. Thank goodness we have these new access points, primary care, urgent care, mobile testing, so on and so forth, I think will be the legacy of COVID-19.
David?
Yeah, there's a bunch of stuff that's transpiring through here. Interestingly, I mean, as this has evolved, we have started a website, all the symptoms and so forth that we're getting. We have had to shut down a number of our departments to be prepared, and we've redeployed that team into a call center. So we have a call center, the 1877 Virus HQ, and we're now receiving over 1,000 calls a day with people with questions related to symptoms. What do I have? All these items, and then we're directing that, giving answers, also directing it to our e-care system, which now went over 9 states. And we're now seeing a tremendous amount of folks using our e-care system as well, which is part of the telehealth medicine aspect. We had that deployed, but now we're rolling it quicker than what we've ever rolled it out before. We've got the telehealth medicine that we've rolled out. We've got the foundation aspects. We've got donations coming in, and we truly appreciate the donations of equipment, PPE, other items that folks have, and we're starting to receive that. What's interesting also about PPE is we used to order it and it used to come, and we didn't necessarily pay a lot of attention to where it was being made and manufactured. And as this has become a big issue, we're now looking at where is it being manufactured, how do we change some of that in the future, what's our reserve capabilities, how do we increase that so that hopefully this will never happen again, but if it did, we wouldn't be relying on sources that might be using it for their own need at that time, and we can use it for our needs as well. So from a company perspective, we're actually Advent Health, we're covering 9 states, we have 50 hospitals, and we're looking at things just all the way across the board on how do we do that differently. Also, how do we shift labor to where these places are going? So as one state might get hit harder in one location, how do we shift labor there? And then as another state and area is getting hit harder, how do we shift it back over here so that we start allocating resources and supplies, as Joe mentioned earlier, across multiple different dynamics that we haven't necessarily done this intense before. So we're looking at that. Our innovation lab has been interesting to see. We're now 3D printing face shields.
Wow.
It's just interesting. We're 3D printing other components. And, we've got a whole innovation lab of doctors and teams that are like, wow, how do we provide solutions? And we're seeing that come out, which has been an interesting methodology. So there's a whole bunch of other stuff that we're seeing coming through here that is innovative, that we're seeing accelerate. And telehealth is one of them, too.
Yeah, absolutely.
Yeah.
Well, from the health department's perspective, we're also seeing shifting some of our services to teleservices as well, because while we've turned the boat a little bit into COVID and reassigned staff, we still have to provide those essential services. There's STD and tuberculosis and HIV screenings and treatments that need to still be provided. Our WIC programs still need provided. So we have to figure out a way to provide those while social distancing, while redirecting staff to work on COVID as well. So it's the same thing, just different services that the hospitals are doing. But another thing that I think has been really interesting is I think we're learning a lot about each other. We learn not only limitations, but capabilities of our partners, and how can I help you? How can you help us? County government, same thing. Social services, same thing. So it's helping us to learn what we really do have and how we can use that in a different way. It's not a hurricane, but yet we still need to pull together to respond.
George?
Yeah, I think our use of bringing in the dispatch area with nurse triage and some of the higher levels, again, being able to use our resources properly, we've actually seen a decrease in the use of transport, which is, I think, a good sign showing that people are being good stewards of the resources out there, and they're working with us in dispatch to get people really to the resources they need and not clog up the emergency system. I think that's been a big success. Some of the other things David had said, we saw some of this in the hurricanes that covered the entire state, and every community was depending on the same suppliers and contractors, and they failed because of that. So we have to look at how we diversify our supply chain so that we're not dependent on an area that may be experiencing the issue. And so those are things that we are learning and implementing, along with all the other technology improvements that were spoken of.
Great answer. Holly, I got a question for me and you. I think, is there any criminal offense that individuals will face if they have been ordered to quarantine or self-isolate but do not? So I'll let you explain your portion of it, and then.
Well, there's different. So there's, if you're a positive test, yes, we can quarantine you, and then we work with you in enforcing that if it's violated. I think it's also come up with the people who are coming through the airport or other ways from those endemic areas, such as New York, Louisiana, New Jersey, I think is on the list. Those, it's a second-degree felony, also with a $500 fine or both, and we use law enforcement to reinforce that as well. But back to one of the comments was made, and it might have been you or David, who said that we need to hear those things from the community because we can't be everywhere all the time. And the community is calling us, and I know they're calling you because we're working together, telling us about people who are supposed to be self-isolated or quarantined, and they're not. So, maybe you could.
That was the second part of the question, so they notify law enforcement, notify you.
Yep.
And then you'll conduct the investigation, and based on that, we'll go to a judge and get an order that person could be taken into custody and forced to quarantine is basically the answer.
In other words, there's some teeth.
To that question. There is. And we would hope we wouldn't have to do it. We would hope that people would take personal responsibility and say, hey, I need to protect myself and my family and my community, but.
And for our positive cases, that's the indication that we're seeing is people are being responsible for those that, the ones that we're calling every day, and those who are under the close contact, monitoring phase.
I have a question from Crescinda Mann. Have you seen an uptick in crimes? And if so, what is the trend? Obviously, we have not. Thank God, crime has actually dropped. Calls for service is down roughly 15% as of yesterday. We did an analysis. One of the things that we are seeing, which is a little disturbing, is since school has closed, we have locked up 25 first-time offender juveniles out between the hours of midnight and 4 a.m., and they're committing felonies. They're committing car breaks, they're committing burglaries, they're committing grand theft auto, and they're committing crimes of violence with a weapon in one case. So my message to the parents is, you have two options here. You can raise your kid, or you can let me raise your kid. And if I raise your kid, I can guarantee you, you're not going to like it. So that's where we're seeing there. The other thing we saw this week was domestic violence in Deltona. The first 2 weeks, it was kind of at a low point. Last week, we had 15 cases of domestic violence. And I think that as this goes on, unfortunately, I think that is something that we're going to see uptick because the abuser really has his family in isolation. There's really no outlet here. He's not going to work or she's not going to work. So, we need to look out for our neighbors in that case because we still do our job every day in and day out. And the last part of that question was about criminals prematurely being released across the nation. There's reality and there's practicality to that. And working closely with George in our jail, and George, please jump in here, we have about 1,300 prisoners in the county jail. Even though they've been arrested and sentenced or awaiting trial, they still have rights and they still need to be protected. So we need to be careful of what's going into the jail that would infect that population. My hope is that the serious offenders, they're not letting loose. George?
Yeah, that's correct. When you hear that, these are usually minor offenses, and we also in the jail use the system for isolation. Right now, things that they may have been able to do, exercise yard, these type of things, of course, they're not doing that, but also where they're housed in the jail. And we have a very robust medical element in the jail. So we're very confident this time, but it's very important that we keep it that way because that is a very enclosed, obviously, population that we need to be take care of, and that is correct, and especially the jail portion of it. Remember, these people do have rights because they have not necessarily been convicted of anything, and so we have to be very careful of that as well.
They said I couldn't dream. Called me a piece of trash and swore that's all I'd ever be. Said a bottle couldn't see the ocean. Give up. Go back to the dumpster. But I didn't listen. I made my way. And now, I am what I've always wanted to be.
Every day, Florida's courageous first responders work together to keep Florida safe during all types of hazards, including wildfires near homes and communities. Florida's first responders are asking for your help to increase safety and accessibility during wildfires with 3 easy steps. Create a clean, fire-resistant space around the home. Make a family evacuation plan and evacuate early when wildfire is near. For more, visit floridaforestservice.com or wildlandfirersg.org.
George, the next question comes from Barbara Wilson, and it's about first responders and protective equipment gear. For the sheriff's office, I can tell you every single deputy has what's called a PPE kit, personal protective gear kit. They have a mask, they were given sanitizer, and we have stuff in stock. We received today, I think, 165 N95 masks and more hand sanitizer. So we are in good shape right now, and how about the rest of
Yes, right now we're in very good shape, and also we work not only for the county fire and EMS, but we work with the cities to ensure that they have what they need. And right now, we're in very good shape.
And my last question is, will deputies be compensated for hazard pay for putting their lives on the line each and every day as they serve amongst the public population during this pandemic? And the answer is the same for first responders as it is for the medical profession. We opted to take this job because of love of our community and to do things better and make things better. So no, we don't get hazard pay. Second part of the question is, I supported my union in a letter that went up to the governor asking that any first responder that would be infected would get workers' compensation. Or be declared a workers' compensation or injured on duty, much like if they fell and broke their arm. The governor sent back to me, or not the governor, but his staff responded back to us, and under the health care laws, there is a provision in there that deals specifically with first responders and the benefits that they would receive if they would come in contact with that, with the COVID-19. George, the county manager I know, and I'll let him elucidate on this a little further, has put something in place for every county employee. God forbid, should they be infected? And George, I'll let you.
Well, right. Well, it's actually also part of a federal act in that, yes, that we have extra leave that has been provided for that use, and we will enact that and use that. There's been some expansion to the Family Medical Leave Act. Parts of that we will definitely be using as well. And then on top of that, as this progresses, we have the ability to look at adding more elements to leave as things go on. You know, our goal is obviously to protect our very valuable workforce and take care of them, and we will do that.
I can tell the community at every phone call or every meeting that I have had with George, the health and welfare of the workforce, he has always put above everything that we're trying to do. So it's a pleasure to work with somebody who realizes that and wants to protect us. I have two questions from the News Journal. You may have got these yesterday, so I don't want to get the News Journal mad at me, so we'll ask you. Doctors, this one is for you. Can one of the doctors please clarify for the audience what doctors use UV light for in dealing with the novel coronavirus? What amount is needed to clean surfaces? What that same amount of UV lighting might do to human skin? What effect temperature UV rays or does the sun have once someone contracts the virus? I think you touched on some of that, but
Yeah.
you want me to do a question by question? It's kind of a lot there. Or do you think you got it?
I think we did touch on it, but there are protocols now where you can put a mask or a stethoscope or some other instrument under a UV lamp. And prolonged exposure to UV rays actually will damage the RNA of this virus, much in the way that if the human skin question, much in the way it will damage your DNA and cause skin cancer if you were to lay under it for the same amount of time. So I think the question really kind of presupposes that maybe you could expose a person to UV light, and that is not the case. We use the UV light in a prolonged protocol to sterilize instruments and inanimate objects.
And then, I guess the other part of it was UV rays and/or the sun what effect does it have on someone once they contract the virus? I guess you're saying, can you lay out in the sun, it'll help cure you?
No, it won't help you in that regard. It might make you feel better and a better emotion and all of that may be good. And that's part of trying to keep yourself healthy and your immune system healthy and functioning well is getting outside and having that. But it is not going to impact a virus that's already in the cells of your body and beginning to replicate, so it's not going to help in that regard. And for those sterilization processes and procedures, the equipment is left in the room, the people are out of the room while this is happening.
Yeah.
Perfect. George, the last question is about the curfew. Do you want to handle that one about
Yeah, sure.
curfew?
Yeah, and you and I have talked extensively about that. And actually, I see that the city of Daytona had gone back in a different direction. It's just not needed at this time. And it could be a little bit of an overreach. Having curfews takes resources. Really, and again, these are pretty unprecedented times, but we've really shut down most of the reasons you would be out anyway. So at the end of the day, if you're out, you still may be questioned. We have not set a curfew time. I believe, and as the sheriff and I have talked, if we were to get in a situation where we felt that it was necessary, we would definitely bring that forward and put it in place. It does disturb me to hear, and I think that should, again, I'll reiterate what the sheriff said for parents, and that they need to know where their families are at. They should know that anyway, and people need to be home. A lot of good Netflix shows and things on they need to, or whatever it is they need to do, but they do not need to be running around at night.
One of the things also is the governor's safer at home order is a 24-hour order.
Right.
Which really kind of null.
Kind of makes a little bit null and void. I mean, but again, I think if we had a very specific situation, we could do that. And, we have in the past during hurricanes and other things of that nature.
Dave?
Yeah, I mean, when you take a look at it, I think today we have already 30 states that have issued stay-at-home orders. So there's a reason why there's this many states that are already issuing these orders. And as George said, there's no reason to be out and about. Everything's closed, during these times. And it's safer to just be at home and be self-contained today. Yeah. And help the community so we can curb this pandemic.
I want to thank this group. I mean, every time I sit down with you folks, I learn more and more and more. I'm so blessed to work with such a great group of people. I'd like to give you the final word. We'll do ladies first. Doctor, final word?
No, just stay home, stay safe, and stay connected.
Holly?
Take a role by washing your hands, keeping yourself distanced, stay home unless you have to go out.
Dave?
Thank you. Thank you for the education that you're providing this community. Thank you for doing this today. Thank you for continuing to post different aspects to our community, keeping them educated. And thank you for the work that you're doing. All the first responders, I mean, that's a tremendous amount of work. Also our medical community, thank you for the docs, the nurses, the staff. And then again, there's a whole bunch of unsung heroes, as Joe mentioned. There's universities, there's labs, there's other folks that have made major donations. The CDC, thank you for the work that you guys have done. This will require a huge team effort from everybody working together to do this. And I truly appreciate the work that you're doing and taking this very seriously.
Thank you guys. Dr. Joe?
I want to say that we are ready. We are ready to take care of you should you need us, and that we just ask that you continue to do your part in this fight out there, and that is to follow those recommendations. Stay out of crowds. Keep your hands clean. Don't touch your face. Cover your mouth when you cough. And please listen to your physicians and to your community healthcare leaders.
George?
Just everyone can be assured of the county's commitment, my commitment to continue to provide the essential services that are necessary every day for our standard of living, to be able to be safe. And also, most of all, my commitment to working with this team and everybody that's here. Will stay in constant contact. And I've seen the power many times of us working through in this county, many disasters. And while this is a little bit different what we've had, a lot of the same principles apply, and we will, I'm very confident with the people that we have, we're going to get through this. And I want people to remain positive.
I hope we meant our goal of this roundtable was to get as much information out there as possible to help you keep yourself and your family safe. But I would like to share something, because I truly believe in my heart that what we're going through right now in Volusia County and America is a test of American character, and it really is going to say a lot about us on what we do in the future weeks that are coming. George, I'll tell you, the other night I couldn't sleep, and I watched an old movie that I really enjoy. It's called The Wind and the Lion. And in that movie, the person who's playing President Teddy Roosevelt is asked a question about American character. And his answer was that the American grizzly bear, in his opinion, is symbolized what American character was all about: ferocity, strength, and intelligence. Sometimes a little blind, sometimes a little reckless, but always courageous beyond a doubt. And I think that's the motto, that we have to be courageous beyond a doubt as we face what we look into forward. And again, may God bless each and every one of you and your families for watching us today, and may God bless and keep guiding this great nation. Thank you very much.
Amen.
Stay connected with the latest Volusia County news, events, and updates on our social media channels. Like and follow us on Facebook and Twitter. Catch up with previous stories on YouTube, or just head over to our website, volusia.org.